Welcome back to Crossroads, and thank you so much for joining us. Today's show is all about women's health, and I have the privilege and honor of having one of the most beautiful women in the world on the show with me this morning. She needs no introduction, the original supermodel. Thank you so much for being here with us this morning. You look as beautiful and as stunning as ever.
Thank you so much, and thank you for that introduction.
Now, you know, I talk a lot about women's health on this show. It's for women, especially women of color, which we all are. And I had problems with fibroid tumors. My mother, all of her sisters, a 30-year-old cousin who just recently had a hysterectomy, problems with my son, Andrew, who's 2 years old. During the pregnancy, the fibroid tumors, we were afraid that we were going to lose him at one point. And we are here today to talk about just that. What's your story, Beverly?
I am the national spokesperson for a campaign called Ask For Questions, askfortell4.com. And I am here to address just what you were talking about, the awareness about uterine fibroids and also the alternative treatments. I had uterine fibroids, which resulted in a hysterectomy. Maybe that was the right thing. I don't know. I didn't know anything about it, and I just buried my head in the sand at the time. And I really just want to have this platform and this conversation with women, because 85% of African American women will develop uterine fibroids. They don't know why. And we need to have that conversation. We need to raise awareness, and we need also to raise the awareness of the other alternative treatments that can be done besides a major operation like a hysterectomy.
Now, Beverly, you know, one of the things is that, you know, we just rely on our doctors. And not to say that the doctors don't have all the information, but whatever they tell us, that's it. We didn't know that there was an alternative. My mother and all her sisters, my grandmother, my great-grandmother, they all had hysterectomies. I think I'm the only one left in the family who hasn't had one, and I have cousins younger than me. Why do you think, especially for sisters, we just kind of, you know, give way to the hysterectomy and say that's going to be it for the treatment of this disease?
Well, I'd like to just add to Beverly's comments. You're absolutely right that many, many women indeed have fibroids. And as a physician, what we want are women to be empowered. And Beverly, as a national spokeswoman for the Ask For, Tell For campaign, is getting the word out so that women, first of all, understand the disease, to know that it is not cancer, and that there are other alternatives, therapies. The symptoms of bleeding, pain, pressure, difficulty during a pregnancy, difficulty getting pregnant are things that physicians can do in order to keep the uterus. There are many, many non-invasive surgical procedures, uterine fibroid embolization, medical therapy, or just taking the fibroids out but leaving the uterus in a certain patient population. So Beverly's own tragic story, luckily she had her children, her daughter, earlier, but she's absolutely right that there are many options, and we want our patients to begin to understand the process, get on that website and look and read about it, and then talk with your doctor. When you're empowered as a patient, you take information, you print it off, you can begin to be an informed consumer. And an informed consumer doesn't get misled into having procedures or treatments that she doesn't want, and knows when there are other options.
Now, Doc, let me play devil's advocate here, because I've gone into the doctor's office with my notes from the net and all of my information, and sometimes the doctor's not receiving that well. They're like, okay, well, I'm the doctor and this is what I'm saying. And some women have shared that with me, that, you know, my doctor's not really receiving the information that I have and kind of tossing it aside. At that point, should you have a second opinion, or should you kind of sit down and have a heart-to-heart with your physician?
Well, I would say that as a physician, I would recommend that you get a second opinion. There are so few communities in which you would find one physician. So your notes, your chart, your reports, your records are yours. They do not belong to a hospital, and they don't belong to the physician. So I would personally seek a recommendation, not from your doctor, but possibly from a friend, from other avenues, and take your record with your history to another physician for a second or even third opinion. So there are many, many ways to become an empowered patient. And it may be that if 3 different people give you the same answer, that may be the right answer. But if you get that someone else can do a surgery or a non-surgical approach and meet your needs, then it's a win-win situation for you. So I'd say talk with a different physician.
Yes, and also I understand exactly what you're saying about the communication between doctor and patient, and the absolute need to kind of have that kind of chemistry with the doctor. I mean, I wish I had Dr. Bradley.
Me too.
Somebody that was listening to me and was, and had the time to answer my concerns, as opposed to, well, this is what I always do and I'm expert in it and I've done 7,000 of these, and and so on, and you become a little intimidated by your doctor. And I think particularly in the black community, we revere our doctors. And so I'm not saying, drop your doctor, but, try to get a communication with whatever doctor you have, and if not, try another one.
And I would also add to Beverly's comment that fibroids are not cancerous, extremely rarely cancerous. And so you have a time to pause, a time to reflect, a time to gather information. This isn't like going to your doctor with appendicitis where you have to have surgery right then, or a kidney stone attack, or something that's very imminently dangerous. It's a nuisance to have many of these symptoms, but it's not, for rare patients would it ever be life-threatening. So we want patients to begin to do their homework, to study and to reflect, and to get on the website, the Ask For, Tell For, and it's the numeric number 4, askfortell4.com, to know what questions, to look at the symptoms, and then to be able to have a constructive conversation with your physician.
Now, Beverly, we can't
And my story's on there, too, in full.
Yeah, and I was going to say, we can't let you go without asking you what's going on in your life. We see you on the cover of Essence magazine. You're always beautiful on the websites, and you're just such a positive role model for our young girls. What's going on? What are you doing? What do you got coming out? Where can we see you?
Well, this campaign is an absolute priority, but I do start the 2nd season of She's Got the Look. We chose the next supermodel over 35 on TV Land, and that's been a lot of fun. And I still have my Beverly Johnson wig and hair extension line, Beverly Johnson.
I know that very well.
My gorgeous daughter is in the October issue of Essence magazine. I'm a proud mother of an MBA, but also now a plus-size model who's, doing very well in the fashion business. So I'm keeping myself busy on the golf course, and life is great.
And you look beautiful, and we thank you for giving us so much of you, and your career has been phenomenal and an inspiration for young black faces like myself. And thank you so much for being here and bringing the doc. We really appreciate your time this morning.
Thank you.
And you guys stick around. Don't go anywhere. We'll have more on women's health on Crossroads. Stay with us.